everyone, this is Dr. Jordan from Pinnacle Chiropractic. We are a prenatal and pediatric office located in Bradenton, Sarasota area, and we are today talking about a word that most people have no idea what it means, and that word is subluxation. So in chiropractic, this term is something a little bit different than it is in most other medical fields, and so it kind of is a term that no one really agrees upon, and in chiropractic, because we focus on kids specifically, it's really misunderstood. So today, this video is going to explain what a subluxation is and how that relates to the issues your kids are having, whether that is sleep issues, gut issues, emotional issues, immune issues, and even things like behavior and the way that they express that behavior. And so this video today is for any moms who feel like they have been down the rabbit hole of the medical world, trying to do medications and getting all sorts of tests done and trying to do essential oils and different supplements and just trying everything they can to help their child because they know their child needs help and there's something missing. And so today you're going to learn what a subluxation is, what it is caused by, and how our care can help with that. So to start off, I just want to tell you, from our experience, there's a really common story that we hear in our office. When we do intake forms on patients, we see the same story play out again and again and again. And so I mentioned that our office is pediatric and prenatal. Some of our love and desire is to help these prenatal moms to kind of fix and lessen the need for our care later on for their children by addressing it earlier during their prenatal care. But what we typically see when we are seeing kids, an intake form will look like the full history from mom's pregnancy or even preconception all the way through now. And moms often wonder why we're asking about how they conceived or if it was hard for them to conceive, what their diet was like. But all of that plays a factor in our child's health today. So we often see in mom's health history that they either had trouble getting pregnant, they had a very stressful pregnancy, there could have been a death in the family, there could have been financial issues, but all of that kind of came to when they gave birth. And almost always there is some sort of birth trauma. And so that birth trauma causes birth injury, and then these kids later on in life, we're seeing them for ear infections, we're seeing them for allergies, we're seeing them for autism, we're seeing them for a plethora of symptoms, and they're basically being seen by so many other doctors. They have an OT, a PT, a neurologist, all of these different symptoms or doctors and all of these different appointments they have to go to and all of these symptoms that are not getting answers to. There basically is no one telling them what the root cause is. And so subluxation is that root cause. But what is that? So when we talk about subluxation, we are talking about basically something going on within the body that is causing it to be in an imbalance between the parasympathetic and the sympathetic systems. So we see when kids have a subluxation or that imbalance, there could be a fixation in the body, there can be a misalignment in the spine, but it all is going to accumulate to basically neurological imbalance or dysautonomia going on within that body, within that system. So we are meant to live in a world where our body can be in a fight or flight state where our body can respond to stress. So if there is something actually dangerous going on, our body is supposed to produce cortisol. It is supposed to save us. It is supposed to make us react very fast to protect ourselves. And then what is supposed to happen is our body recovers from that stress and comes back to our parasympathetic side where we can rest and digest and heal and grow. You cannot do both things at once. And so if your child is unable to get themselves out of that fight or flight, they're going to have trouble doing the other things, like the resting and the healing and the growing. We see a lot of children who will struggle with pooping, with sleeping, with turning their head. They have constant stress, and so their body is basically showing that in symptoms, and they're not thriving. They're not on the growth charts. They're doing pretty poorly in a lot of the internal areas of their body system. And so we have a handout we like to give to patients that kind of shows this gas versus brake, what is going on within the body. When we see this, we see the gas pedal on this side, and that is that fight or flight. That is basically their body turning on that gas and revving that engine, and they can't come off of that. Their body basically thinks that every situation is causing them to fight for life or death. Like they have to use all of their energy, expend all of their resources to make sure that they can stay alive. And so their brain is not focused on anything else but that. which means their body can't do the healing and the growing and the resting. And so what we see are these symptoms down here. That's really, really common. And so when we see those intake forms and they all start with that birth trauma, then we see them have colic when they're little. We see them have sleep problems. They have inflammation issues. They have food sensitivities. They will have ear infections. And then all of that also leads to other symptoms. So pediatricians will often say, oh, they will outgrow ear infections, or they will outgrow the colic. They will outgrow their dairy allergy. What happens is they grow from that into something else. So you don't just outgrow ear infections. The cause of why you're having them never went away. It just caused another sign and symptom later on in life. And often that is the behavioral aspects that you're seeing, the emotional outbursts that you see. And so the body it never had a chance to heal. It just transitioned as their body grew into another issue and another sign and symptom. So that subluxation, that part of their body where they're stuck, where their body is unable to recover from the fight or flight, it adapts to staying in that fight or flight. It adapts to being stuck on this gas pedal where they are just going 100% all of the time. They are not getting this brake pedal. Their body's not able to recover. And basically what happens then is that they are never going to be in a position where they are handling situations appropriately. And that can mean emotional, that can mean internal, where things are not able to heal on their own, which your body should do. And so what we often see is that this starts with trauma. And so these are the three main causes of subluxation. This is where we see the problems start and kind of grow all the way into where we are just stuck and living in fight or flight, but like also just living every day on eggshells, wondering what's going to happen with our child. So the trauma is the first thing. That's that physical stress we see. That is what I'm talking about when I talk about our intake forms looking the exact same for every patient. The major cause and the major thing we see is stress, either during birth, stress trying to get pregnant, or stress immediately after birth in that 4th trimester. But the physical stress during birth is a very, very big reason that we are seeing so many kids today struggling. We definitely have the sickest population of children that we've ever had in the world. And this is one of the reasons that we are seeing over and over again that we believe is a really big cause. And so when we see birth trauma, it's really disheartening because we are also seeing so many prenatal moms, and we are hearing the stories of them coming back from their OB and saying, baby's measuring really big, I have to get induced. Or baby's not growing, my placenta is not in the right position, so I'm I'm ruled out for a vaginal delivery. Instead of there being an option to see and to wait and see if the placenta can move, which it can. We see story time and time again of all of these scare tactics being used, fear being put into moms, and just the emotional stress, which we know emotional stress during pregnancy translates to that baby. So the more moms are stressed and are told that their body is not capable and are told that their body can't give birth as they hope, and they have to get induced, they might end up in a C-section, they have to do this way, it causes that emotional stress from a really early stage. And then during that birth, when mom is on her back with Pitocin, very, very strong contractions, with other interventions, maybe a vacuum, forceps, episiotomy, maybe a C-section, then that physical trauma comes into play. So how do we get kids from that physical trauma back to this brake pedal? Is we work on their vagus nerve. That very first bone in your neck houses that vagus nerve. It's responsible for protecting it. And so that vagus nerve is what gets disrupted, and that imbalance starts, the dysautonomia, the neurological wiring becomes haywire from the get-go when that very top bone in the neck, the upper vagus nerve, the upper bone gets misaligned and it gets malpositioned, it gets fixated, and it gets to a point where children cannot function as they should. And so by correcting that vagus nerve, by looking at the rest of the body, trying to find the cause of what's going on and not just addressing the symptoms, that is how we get kids out of that fight or flight and back into that brake pedal. If birth trauma is just the beginning, then we'll see the toxins come. And we see this brake pedal starting to go the gas pedal going all the way to 10, where the foot is just pushing the gas so hard. Toxins are a really big thing as well. We live in a very toxic world. Everything that we are consuming is arguably toxic, whether it's our food or water, all of the things that we ingest and that children are given. Things are labeled in a really nice way to make it seem like it's clean or green. And there is so much false advertising and just a lot of unknown of what we're putting into our own bodies and our children's bodies. So then we have the toxins on top of the trauma. Then that's going to lead us all into these thoughts, these emotional dysregulation, the emotional component where we're seeing kids' behaviors just go off the chart, and kids are potentially going to be kicked out of school. Kids are looking at suspensions. Kids are looking at being turned away from different things, not having friends, not being able to do sleepovers and, hang out with the kids in their class because they aren't able to control what's going on inside of them. And a lot of parents don't realize that it's something else internal. It's maybe not their choice. And so trying to look at if that nervous system is balanced is a really great way to say, okay, this is what my kid has going on. It's not their fault. We need to work backwards and try to eliminate those toxins from the body, eliminate the stress, eliminate all of those pieces so we can get their neurological systems balanced. And we see so many times, again and again and again, when people come to chiropractic care by a prenatal or pediatric specific chiropractor who has a lot more training in the neurological world of chiropractic, these symptoms that you're seeing start to dissipate. They start to go away. Your child can thrive again. They can sleep. They can poop. They can have a better immune system. They can have better emotional regulation. And so all of these subluxations in our body basically alter how our tone of our body is, our motor function. They're going to alter our immune function. And so when we see that the body can work at a more stable level, when the body is in a happier place, when the body doesn't think it's constantly in a fight for its life, then we can see all of these positive things start to come back in. So if this video has resonated with you at all, if your child is struggling with any of these things, if you know someone who has a child that's struggling with some of these things, or you're thinking, wow, I had a really traumatic birth, ding, 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 I want to prevent any of these things from happening with my child, comment, share, DM us, share this video with a friend if you have one that could benefit from it. And Dr. Matt will also be hosting a workshop at our office on April 27th, and that will be at 6:30 p.m. We will have a link to register soon, and that's a great place to just learn more, to learn more about what we do, more about what subluxation is, more about how it could have come about and what you can do to help your child to solve that. Thank you. I hope you guys loved this and have a great day.